Every eye disease explained, orbital and preseptal cellulitis. Now, this was a comment in the last video, and it's a good question. It's a really important one. It's, again, one of those which you have to get right. It's one which can be sight-threatening and even life-threatening. So preseptal cellulitis is an infection in front of the orbital septum, usually limited to the eyelid tissues. Your common causes, things like an insect bite, trauma, styes, recent surgery, and your signs are the obvious ones, things like lid swelling, edema. If you have quite a bit, it might even cause ptosis. The patient might report it as tender and warm to touch. Now, it's important to note for preseptal, things like motility, visions, pupil, colour vision, pressures, they're all usually normal. On the other hand, orbital cellulitis is infection behind the orbital septum, and this usually involves the orbital fat and the muscles. Now, common causes here are things like sinusitis, trauma, dental infections, or as a progression from preseptal cellulitis. Now, as well as all the usual cellulitis signs like the lid swelling and edema, you might expect to see restricted eye movement, a drop in vision, colour vision affected, and potential RAPD. The pressure might be raised, and they might even report more general symptoms, things like malaise and general fatigue. Now, the reason it's really important to get right is orbital cellulitis means it's in the orbit. It can get to the eye, it can get to the nerve, the vessels, and more importantly, it can get to the brain, which means it can become life-threatening. So if you are unsure, just treat it as orbital, play it safe. It's an emergency referral to the eye clinic, where it's usually treated with things like antibiotics. Ask any questions that you might have below and let me know what I should do next.